a few of you know some of this. A lot of you who may watch the video don't. So I will break this down into extreme basics, and Robert, Katie, you two are the ones who truly may not be as aware of some of this. So
okay.
I will break this down into basics, and then I'd rather do this fairly informally, so we'll do it kind of as a discussion. As most of you know, I was diagnosed with leukemia back in January of 2012, but things actually started as early as 2007. I was 11, and my first sign that something wasn't quite right was them telling me I was a carrier for TB, of all things. And I had had 2 previous tests that were negative, and then all of a sudden, oh, you were positive for TB. And it's not any false positive either, because it's a little 2-inch flare and not some slight reddening like you'd see if you got too much soap over the site. And so we didn't think much of it. We just thought, well, okay, she's a carrier for TB, so what? Went through the treatment, went through the fun and games when they screwed up and messed up my vitamin B absorption levels by not telling me that INH likes vitamin B. Vitamin B super complex, and 6 weeks of B12 shots later, that episode was over. Or so we thought. 2 years later, I had a back injury, and about 5 months after I had the back injury was the first time I lost weight. And I'm not talking a pound here, 2 pounds there, a pound over here. I'm talking 10 pounds in a month. I went from 110 down to 100 and have barely managed to maintain much above that since.
Wow.
Unless I've managed to retain fluid from chemo, and then that's a different discussion, which we'll get into in a minute. I went to different doctors. They tried everything. Nothing worked. Nothing. When I was 15, I contracted what they thought at the time was mono. I found out after I was diagnosed, I had cytomegalovirus, which has to be treated with an antiviral, or rather an antiretroviral. Unfortunately, it doesn't work if you don't actually realize that that's what it is. So we didn't think much of it. We just thought I was somebody with a very weird body. Because I kept picking up infections. I kept picking up weird conditions that you wouldn't think somebody my age would have. And after that, it was shingles. And then we really got into trouble around August or September of that year. That would have been August, September of 2011. By this point, I had started blacking out most of the time. People moved around when it happened, so no one ever caught me at it. I especially would have it happen in the shower. I'd be getting ready to crawl out of the shower, done with my morning routine, crawled out of the shower, and I would wake up draped over the side of the tub with no freaking clue how I got down there. And then in October, I had my wisdom teeth pulled. This was about 3 months before I was diagnosed, officially. I started bleeding about 3 weeks after my wisdom teeth were pulled. The bleeding wouldn't stop. Eventually, I had to pack my guns, and it just got worse and worse and worse from that point. It finally culminated in my collapsing right before a choir concert. It was my last Christmas concert with CCGC. And I had... This is not... Let's put it this way. It's funny now. It was not at the time. That year we were doing a piece called Snow. And there is a phrase in said piece that says, the snow must melt, must go. We hit go, and I felt myself tilting slightly backward, just slowly. And then all of a sudden, I wake up on the floor, half under the piano with 30-odd girls and my assistant choir director staring at me in a complete panic, and only one girl and her mother keeping their heads enough to help me. And that one is one girl who, if it hadn't been for she and her mom, I would have collapsed a lot earlier, because Claire had a blood disorder And her mom realized I was severely anemic before we knew and started compensating for it without drawing attention. I didn't realize what she was doing until after all was said and done. Anyway, I come out onto stage, sitting quietly in a chair, standing up to sing, and then sitting back down. I come down off the stage, and everybody's like, "Oh, what happened?" And realize by this point, I've probably blacked out 8-10 times. So I'm kind of like, oh, it's another blackout. So what? So my response was basically, oh, yeah, I blacked out. A couple days later, my friend Claire walked up to me and was like, now I know how my parents feel. Don't do that again. And I was like, I'm going to try not to. Ironically, less than 45 minutes later, same piece, same phrase. I start feeling like I'm going to do it again. Fortunately, I realized what was about to happen and dropped to the floor before it did. But trust me, when the initial stage, and you're not even sure what's going on, is you're blacking out or you're headed for blackout, that is not fun. It is not amusing, and it is not helpful. The last episode I had before I was officially diagnosed was my last concert that I ever did with CCGC. We did with the North Carolina Symphony. And we've all, those of us who are blind, have all probably had the experience of arcane chords popping back and smacking us one. You know, the old-timey metal chord grips where the loop is connected, and it's that little thin metal piece. Well, that popped back and hit my thumb because I was using an old aluminum cane at the time. It popped back and hit my thumb. All right, painful, but not exactly problematic. Or so I thought. Until about 10 minutes later, I took my hand and I did this, kind of tapped my thumb and index together. And I realized I felt something down. And then I realized I was bleeding out from under my nail. So I turned my head and looked at the girl next to me and I said, I really wish I had a Band-Aid right now. She glanced over and was like, oh my God. And fortunately, they found me one. But that was how it started. Those little things, and there were more things like that involved, and we can get a bit more in depth in a minute. But the day I found out I had cancer is a day I will never forget. I don't think anybody who was there will ever forget it, but I definitely won't. Because the doctor who told me had no bedside manner. Absolutely none. He marches into the room, calm as you please. I don't know if he was burned out or just not using his head that day. He waltzes in, sticks his head through my curtain because it wasn't a full cubicle door, it was just a curtain in the ER, and goes, 99% chance you have leukemia. We're transferring you to UNC. Turns around, walks out the door, and that's the end of the conversation. And that was how I found out I had cancer. Mm. And I was like, okay, talk about the emotional equivalent of bombshell. That was it. And after that, it was all she wrote. Mess with chemo, mess with not being able to keep things down, my taste buds changing. But the part of it that was the hardest were the social changes, because as an adolescent patient, kids don't know how to handle someone with cancer at the best of times. But small children usually will ask questions. You know, Mommy, what is that weird thing that's sticking out of so-and-so's chest? Mommy, what's that weird button-looking thing? Mommy, why does that person have no hair? Things that small children have no compunction in asking. High school kids, they don't ask. They don't want to know because they're too scared of it, and the adults don't know how to handle it. So, for everybody watching, and not actually here, your first lesson in what never to say to an adolescent cancer patient. 2 weeks after I was diagnosed, I tried to go back to school, and I managed 6 weeks. But anyway, I walk into class. I'm on a gait belt, which basically looks like a strap around my waist, and it's the only way I'm staying upright at that point with somebody holding me from the back. I walk into class, and my teacher looks up from her desk. And I'm expecting a good morning, I'm glad to see you, so on and so forth. She looks up from her desk and goes, if you lose any more weight, you're going to fly away. Had she stopped there, I would have been slightly uncomfortable, but would have looked the other way. But then she compounded it. I wish I could lose weight like that. I don't know exactly what look I had on my face. Not for certain. But I turned my head and I looked at her and I said, no, you don't. You don't ever want to find out what this is like because the price is too high. She backpedaled so fast it wasn't funny. But I've gotten a lot of comments like that over the years from people who mean well, but they don't know what to say. So they come out and say really stupid things to me. I've also essentially over the years been treated as the freak who dropped off of some planet that they can't even find in outer space, never mind name. And a lot of people don't want to deal with the concentrator, the chair, oh, she's too weak. Her energy levels are shot. She has nothing to work with. Nothing. And it's been hard the last 10 years because from a social aspect, there are people that I'd love to spend time with, but most of them are kind of like, oh, it has cancer. What do we do with it? And the funny thing is, if I look at the way that I see people react when an adult finds out they have cancer, it's a lot of times, what can we do? How can we help? But when it's a pediatric patient, a lot of times, unless it's a very young child, it's, oh, it has cancer. What do we do with it? Never mind that it has one of the rarest forms of blood cancer known to creation. So, on that note, let's open it up for a slightly more informal discussion.
Do you get phrases like, you're so brave, or...
You're such an inspiration.
Yeah.
You're so amazing. Brave, I don't mind. But the amazing and inspiration, yeah, I'd like to collapse on the floor some days and start kicking and screaming. Because the chemo over the years has been hard. It's been every couple of years, either the chemo or the cancer or some complication of the two tries to kill me. And trust me, I keep it together, but there's some days it's like, really? This again? Because it's been 4 relapses, not counting the initial diagnosis, it's been 4 full relapse modes and 1 partial. And the last partial is why I switched chemo this last time. But the first chemo was stomach issues and blood-related fun and games. The second one, I didn't find out what its specialty was, meaning what its special target of choice was, because it tore my stomach lining out with its adverse reaction. And I had to come off of it within a month of starting it because it was too aggressive. The third one I tried ripped every migraine control I'd ever had out, and unfortunately, the years of chemo have given me what are known as undifferentiated intractable migraines, which means migraine all day, every day, sometimes with a lot of pain, sometimes not. They can do a lot for the pain, but they can't do much for the aura. So it ripped every control I ever had out. In this current one, its special target of choice is heart trouble. So EKGs and beta blockers if I start with trouble, and if they can't control the condition that it causes, well, chemo switch it is. And the next one that they'd probably try likes causing blood clots. The last drug they could try, who knows, it's too new. And the only truly curative treatment is a bone marrow transplant. Bone marrow transplants are never easy, but I was given about a 30% chance of even surviving one should I try because of genetic markers and the fact that I have CMV, at least the antibodies for it. They were afraid that it would reactivate. So I was basically told, if we have to, we'll do it. but not unless we have to.
I've almost lost my child so many times. It's old hat. It's not a trauma anymore. Oh, you might lose your child. Oh, okay.
Oh, my child is dying.
Oh,
What a surprise.
What's
She's
new?
done this. She's done this 4 or 5 times
And I
before.
mean, at some point she could die, but it's gotten to the point that, oh, okay, she's dying.
And it's not old hat in the sense of, oh, my kid's dying, so what? But it's like, oh, this again. Is she going to make it through this one? Who knows?
I appreciate you're sharing more with us and what you've gone through on this journey. I know you as Daria. It's and I know you have leukemia.
Yeah.
But I know you as Daria, and I appreciate hearing more in depth what your journey's been like. Yeah. Where do you see God in this?
I wouldn't have been able to do half of what I've done with dealing with my dad's stuff, with Sheila, with any of it. Without the cancer, as weird as that probably sounds, because think of it this way. If I hadn't spent, by the time my dad died, if I hadn't spent the previous 3 years or so in the system dealing with doctors who didn't give all the information, doctors who constantly were asking me, well, how do you label your meds, and blah, 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 blah. And by that point I was fighting the, can I please have a port, because blowing my veins out every 5 minutes is not funny anymore. It wasn't funny the first time, but blowing my veins out to get a blood draw or an IV, no thank you. When you're sticking somebody 6 times in a row, it's time to quit. But, when you're dealing with stuff like that, when he took his last turn, I knew enough from having dealt with my own near-death experiences with dealing with the doctors who didn't want to give all the information because it was, information, that they didn't think I needed or didn't think that as a blind person I could handle. Yes, it's sometimes the fact that I can't see does come into it. I was able to make the decisions to help him survive long enough for his mom, my grandmother, to say goodbye. And if I hadn't had the cancer, God kind of dropped that one in my lap, and trust me, I'd be happy to give it back some days. But I've never regretted what I've had to go through, because it gave me the knowledge and the wherewithal to do what needed doing when the chips were down. Because when he took his last turn, he wasn't communicative. Well, verbally he was, but he wasn't making sense. So they came out and they said, he wants you to sign his consent forms. This was before he went to the point where he just literally wasn't communicative enough to tell us even that much. But I knew enough about catheters, about exactly what they were telling me when they told me his nuclear heart test was bad, what they were telling me when his sodium levels dropped. I understood enough from having dealt in the system and been watching my own blood levels for so long to know what they were telling me and not to go, ugh. And Des, I'm going to ask you to stick your nose in this one at this point, because it might be good for you to explain what it was like that last year before I was diagnosed. Because when Des and I truly got close was actually because I was, what we thought at the time was severely hypoglycemic from the cancer. So Des, if you want to have fun for a minute.
Yeah, when I met Daria and I was watching her at a chapter meeting, but it was like quiet. And the thing about it is, you know, I looked at the journey of why we came close. I looked at the journey of, about where she was, but I was trying to understand Daria because, and then I asked her, would she accept me being her godmother, because I had someone in my life that was my mother, and she taught me a lot of things. And in my spirit, I wanted to give Daria the support in what she gave me. And I really understood Daria's condition more. Is like I read like 5 books. The one book that was really, really inspiring, it was like they were 5 friends, and they went to what is it?
Mount Sinai.
Mount Sinai Hospital.
New York, by the way.
New York, and they became friends. The youngest one was Eric, and they flew him in from Mexico City, and he came up there, and he became friends with Erica, and I'll call her Susan because I couldn't pronounce her name, and then it was another one. Her name was Shannon. So they were all friends, and everything that Daria had experienced so far that I knew, they were going through the whole thing. Like they lost the lining, and so meanwhile, while this book got printed, is because the last one that passed was Susan, and she told her parents to publish it. She kept a journal, and it was so fascinating about the markers, about the early. They were with the early chemo, the first sets.
Oh yeah,
they went detail.
And maybe
so
nilotinib, yeah.
That,
which I can explain in a minute. Anyway,
that and then there's 2 parts with me with Daria.
Mm-hmm.
The one part is her humanness, and I listen. Me and her talk. I listen, and I tell Daria. I said, Daria, no matter what in this world, you have a will.
Mm-hmm.
And your will is really important. I can want what you want, and everybody wants the best for you, but your will. And I would listen to, I won't get into it, but because like different deep stuff that she would tell me. And I accepted it, and I said, wherever you are, wherever you go, and what your journey is like, I will support you to the end. And I said, I was put in your life for a reason.
mm-hmm.
And I have a group. There are 20 women, and their vocation, they're praying now. All around the clock, they pray for Daria.
Amen.
They pray for her. They see visions. They see things. They know things. They just like, and I'm glad those women in me, because their faith helps me gets me through.
Every now and then
To
I
help
have
her.
to go and say, have you heard from the sisters, or have you heard from the group?
Well, I think the thing to kind of keep in mind too is a lot of people cannot accept the fact that I've accepted, how to phrase it as gently as possible, I've accepted the fact that at the end of this, if the cancer doesn't get me, something to do with the chemo probably will, provided that nothing else freaky occurs, which we are all capable of stepping into something we didn't see coming. But the reality of it is, chemo's not gentle. And the average life expectancy for this type of chemotherapy is approximately 20 years.
Mm-hmm.
January will be 11 years for me. So I'm just a little over halfway through the average. Now that doesn't mean I'm just going to drop dead at 20 years, but the longer it goes, the more interesting it becomes in terms of comorbidities and fun and games along those lines. But the funny part is, actually before 1998, there was no treatment at all beyond a bone marrow transplant for my form of leukemia. I have chronic myeloid leukemia, which is about 2% in pediatric patients under the age of 15, and maybe 9% of all pediatric patients within the age of 15 to 19. I was 4 months past my 16th birthday when I was diagnosed. And for most people, because this type of cancer usually likes men over 40, don't ask me why. I have no idea. The few people who are actually aware of what CML is are like, what? You have CML? Yeah, I know. I don't fit the paradigm.
It's
Her
a lot
best
of
friend that
education.
has it is in his 80s now, we think.
He's 85 or 86, and he's 23 years into his. And in his case, when he was initially diagnosed with his, he had a much higher white blood cell count than I did, but he probably had a much higher blast cell ratio as well, which I'll explain that in a second. But the whole problem for him was his spleen became enlarged, and he would tell me later that when I first met him, that if he had gone on the trip he was planning to go on at the time he was diagnosed, he probably wouldn't have made it off the plane because his spleen would have ruptured. And when I contracted CMV, one of the problems I had was spleen and liver enlargement, to the point that they were actually saying, you do not stand, you do not do anything, because you stand for too long, you move the wrong way, and your spleen will rupture.
And he just went on a big cruise. He went to the Baltic, everything,
Baltic, yeah.
and they gave him clearance.
Mm-hmm.
And his wife said they gave him clearance, but his wife is a real strong lady, and she's got
Oh yeah.
more than a mustard seed. And she said she prays for her husband, and they pray together. They do scriptures and stuff.
It's all you can do.
It's But I'm just saying these stories, that she's sharing. But I'm so glad that I got to learn it better.
Because, like I said a minute ago, with the spleen enlargement, I still have mine, and some of the research now suggests that prophylactic splenectomy is a possibility, and in some areas they actually do prophylactic splenectomies if it's a pediatric patient, because clinically, a pediatric patient is more likely to present earlier as a more aggressive setup. In other words, let's say in my case I was a 1% blast cell ratio, which means a very low level of cancer cells. With that 1%, my white blood cell count was already over 120,000.
She was more dead than alive.
I was almost dead by the time they caught it.
Wow.
Because it had been so initially aggressive. And I was told by the oncology fellow that if they hadn't known better, if they hadn't seen the markers, because the bruising was so bad on the upper half of my body, they would have thought I was actually being abused. That was literally how bad the bruising was. It looked as if I'd been beaten rather than somebody had done something else. Like get hit with something.
The day she was diagnosed was the longest day of my life. There's never been a day that long before or since. She went to shaking, I went to crying.
Jonah lost it.
Jonah stuck his nose in the air and went to howling. She stopped shaking long enough to tell me to get him under control, and then she went back to shaking. It was really, and then it was like in the wee hours when we finally got to UNC.
And there were like 4 people crammed in the room at 2:30 in the morning trying to show Mom where stuff was, and they wouldn't shut up.
And Mom didn't care.
Mama didn't care, and I finally had it and turned over and went, shut up and go away so I can get some sleep. Fortunately, because 3 hours later, my oncologist that it took me 2 years to trust to tell her when things were going wrong, because Dr. Blatt was a firecracker, but that's a different discussion entirely. She comes into the room. Hi, I'm Dr. Blatt. Can I feel your belly? And I'm like, whatever. Suit yourself. Whatever.
Jonah was in such a mood that night that we had a fight over the sofa, and he won. At 2 a.m., and I'm dog tired. I'm not going to fight a growling maniac.
No, growling animals are a
That's
big
just
fat no-no.
no.
Well, Daria, thanks for sharing your journey. And,
Thank you. Yeah.
and I certainly, I can say for me that, I have more insight in what the journey's been like.
Yeah, and
And,
it took me
Yeah.
took me almost 6 years to win the battle of getting a port. When I finally did, it was like, oh, thank you, God.
well, you're a fighter, obviously.
If I weren't, I'd be dead.
Yeah. So, thank you.
Mm-hmm.
It's about 10 after 8, and so we need to go ahead and put the chairs up, and your cab is about going to be here at 8:15, right?
Yeah, that's
So
what
he
he said.
says.
So he claims.
So he said.